Okay, this is Alana Allen. This is my project over my periodontal synopsis. My patient's name is Billy Bob Moeller. He had perio stage 3 and he was grade B, since this was his first time in the clinic. So his health history, he's male, 31 years old, high blood pressure, frequently takes allergy medication due to outdoor allergies, which causes his dry mouth, and he also has GERD. His dental history, his last cleaning was 20 plus years ago, so as a child, he neglects hygiene due to mental health disorders, sensory overload. He has Asperger's syndrome, depression, and anxiety. He brushes every 2 weeks, has bleeding gums. His gums are bulbous and inflamed, and extreme sensitivity. And he has declined fluoride treatments in the past due to texture and taste, but he luckily agreed that he would go through with fluoride treatment for this. So upon EOIO, you can see that his gums are very inflamed, especially in the next slide. There's some bleeding, very irritated bulbous papilla. He was really sensitive upon probing. And there was, like I said, a lot of bleeding. So this was his calculus charting. There was a lot of calculus, obviously, mostly generalized in the lower anteriors, but we had lots in the posterior as well. Here's his x-rays here. You can see some bone loss in the bite wings there, next to his premolars, and just overall generalized bone loss. So the bite wings and posterior PAs show the generalized horizontal bone loss and localized vertical bone loss in the premolar areas. His dental chart was actually kind of shocking. He didn't really have any decay. He had a couple sealants placed. And one of his second molars were impacted mesially. He also has a retained primary canine tooth as well. So this was his probing measurements. He had lots of 4s, and he also had a couple 5s as well, and with those 5s there was also bleeding on probing, which is just kind of a telltale sign of periodontal disease. So these were his risk assessments. Both of them were in the high category just due to his overall dietary habits and how frequently he was brushing. He did say that he ate a lot of proteins and starches in his diet, and that was reflected obviously in the probing depths as well. And his plaque index score was 63%, so very high. So his risk factors for periodontal disease are as follows. He has very moderate stress, poor oral hygiene, sensory and dexterity complications. He is male, his age, and irregular cleaning intervals, or in this case, no cleanings for an extended period of time. So I was fortunate enough to have him return before this project was due, and this was directly after treatment. I took some after pictures, and you can already tell a difference. The gums are already a little less irritated. Unfortunately, I don't have the time to take some pictures after he has already healed, but after going over a brief OHI, he had already told me that he was brushing more frequently. It still wasn't twice a day, but he was trying, and that was good to hear that. So yeah, he said he was brushing twice a week now instead of every 2 weeks. So, baby steps, progress, it's something that we like to see in patients. So I would say if he keeps at it, at his oral hygiene at home, and if he invests in the aids that I recommended to him, like the water flosser, then I think the prognosis for this patient is pretty good. And that is the end.